Hi viewers, I am Dr. N. Ragavan. I am a senior consultant Uro-Oncologist and robotic surgeon. My special interest is on prostate and prostate related disease including cancer. A lot of people would have heard the name prostate. Prostate is an organ which is situated in the bottom of the tummy. This is a very important organ for men, especially when they are young in age. It is important for the maturity of the sperms and for them to have babies. However, as we grow older, many men suffer with the problem related to prostate. The prostate becomes an organ which is tight and doesn't let the urine flow well. Sometimes the prostate becomes bigger and that also causes problem with the flow. Many people will experience it. Just go and ask your dad, your uncle, anybody who is about 45, 50 or even 60. Definitely they will say, oh, I'm getting up in the night often, my stream is not that good, I'm struggling to pee. These are things they commonly comment. If we are not able to read well, do we hesitate to wear a spec? We don't. We wear a spec and we feel comfortable with that as well. In the same way, one should not feel that they have to suffer with the urinary problem related to prostate. So what should they do? You have to approach a doctor and ask for help. The doctor will run some tests for you, some blood test, a urine speed test, an ultrasound scan, etc. etc. And after that, they will decide whether there is just a benign, a non-cancerous enlargement of the prostate or whether there is a possibility of a cancer in the prostate. Then the doctor will take a decision to give you medicines in most of the occasion. Today we are going to talk about patients who don't succeed in the medical therapy, meaning that they suffer in spite of having medical therapy. Those are the patients who we are going to discuss today. What will we do for those patients? In the ester years, there was only one treatment for them, to put a camera and shave the prostate. This is called TURP, commonly called TURP, and you would have heard a lot of your senior citizens in your house would have told the name TURP. That's related to this operation. The problem with this operation is that 3 to 10% of the patients can run into complications. That includes reblockage, bleeding, readmission, requiring some extra procedure, very rarely urine leak, etc. So, whilst this is the most commonly done operation, there were things that were associated with the problem. This matters a lot when you are reasonably young in the age. In today's world, a 50 or a 60 is not considered as an old person. They are young people. They are sexually active as well. These are the patients who suffer a lot with the TURP operation because they experience something called retrograde ejaculation. Some of them will have erectile problems as well. This is where the modern technology really comes to help. Of late, we have a procedure called UroLift, which is just to imagine you're putting some staples in the prostate and pinning it together so that the pathway opens up for you. UroLift is a procedure which was introduced almost 10-15 years ago elsewhere in the world, including United States, and is commonly done elsewhere in the country, elsewhere in the world. In India, UroLift got introduced a few years ago, and we at Apollo hospitals have started doing that operation as well. There is a distinct advantage in UroLift. First and foremost, it's a very simple operation to do. This is an operation which has almost no known complication. The patient's erectile function is well preserved. The patient's ejaculatory function is well preserved. The symptom relief is very nice, especially at 3 months. Imagine yourself, on one side you have an operation where there is at least some amount of complication, and on the other side you have an operation where there is no complication. You want to choose that, don't you? However, not everyone is a candidate for UroLift. We need to be selective in the patients who will have UroLift. So you can discuss with your doctor about that as well. There are some criteria for doing UroLift. The prostate should be of a reasonable size, not too large, not too small. The flow pattern should be very clear. In our language, we talk something called median lobe, something like a little lump in the middle of the prostate, which causes ball valve effect. If there is a median lobe, especially a large median lobe, UroLift cannot be done. So, whilst we exclude those patients who are eligible to have UroLift do extremely well. They are all very happy that they've gone through it. How is it done? It's done as a day case. Come in the morning, go in the evening. After the procedure, sometimes we leave a catheter for a day or two. Sometimes we don't leave it as well. And even if you leave a catheter, after the 1 or 2 days time we'll remove it off. Initially for the first 10-15 days you'll experience a tiny bit of irritation or a burning sensation, but come down 15 to 20 days you'll not experience any of these things. By 3 months I'm sure that the patient who underwent UroLift will feel tons better. Will this operation be durable? Literature says that these operations are very durable. The number of patients requiring any further treatment in their life is only a few %, and that also down the lane or after many years. So a young patient who is sexually active, who wants to preserve the sexual function, would always choose a UroLift procedure in order to make sure that they are still having those preserved function for at least for 5 to 10 years or 10 to 15 years. Viewers, I hope this information was useful. If you want to reach out for more information, please let us know. Thank you.